have Mushtaq now coming on, who is a epidemiologist. I'm going to ask her some questions about COVID-19. I know it's in the top of our mind. This is why we are doing this type of platform right now. It's great that we have this type of connection now that we can reach to a wider audience, because back then we probably would have had like smaller events. So now we can widen our horizons. So it's really important. I'm gonna try to get Mushtaq. Hi, Assalamu alaikum.
How are you, Faisa?
I'm good. How are you?
I'm good, alhamdulillah.
How is everything? How are you doing with the quarantine?
You know, as good as you can be, alhamdulillah. We're so close to each other right now, but
I know. We're in DC, and it's so sad that I'm like, we've been following each other for a while now, and it's a great time for us to like go get, you know, coffee, but
yeah,
unfortunately Miss Rona has taken over, so
completely taken over our lives. Yes. Yeah, it's crazy.
But yes, I wanted to introduce Mushtaq. She is a fellow at the CDC. She's an epidemiologist and has a master's in public health from Emory University. She is also a Ohio State alumna. So yeah.
Oh wait.
And a Fulbright scholar. So she is, yes, one of our shining and one of our like amazing members that we have at SLPA. So yeah, so
thank you.
Do you want to add more, or did I do a good job?
No, that's enough accolades, I think. Yeah, let's start by you. Yeah.
Well, we're both, I mean, am I right? We're in global health. You specialize in global health as well? Okay.
Yeah, global health,
okay.
Infectious disease concentration. Yeah,
okay.
But global health is like what I studied. Yeah.
Okay, perfect. Yeah, I did a tiny 1-year stint at the Infectious Diseases Society of America. So I was doing some of their website design. So it's not really
nice.
Yeah, but
no, but still, that's like super important.
Yeah, so somewhat. But here's some questions that our members basically had is as an epidemiologist, what is your thoughts around the COVID-19 response in America?
That's a great question. I think one thing that's really fascinated me is the role that culture plays in the public reaction to a pandemic and the effectiveness of like health communication. So like the way that say like Hong Kong or South Korea reacted to this versus the US or the UK, I think it has a lot to do with culture, historical context and values. And I think in the US we have like a huge, I think, value in economic stability, and oftentimes I think health, like human health on like a personal and public level, are often overlooked if things are going well. But then the minute something goes wrong, it's like, oh my God, public health. But I think we really deal with failures in leadership, in federal coordination, and the failure of rolling out widespread testing from the beginning. I think all of these things severely compromised America's ability to control the pandemic from the beginning. And I think science should systematically guide decisions at all levels. And I don't think this is a controversial statement, but I want to emphasize my personal opinion, that the response in the US has been poor because it devalues, generally speaking, scientific evidence-based research. Yeah, so I would say, just to sum it up, I think poor is
poor
the
response.
Answer.
Yes.
Yeah.
So I totally agree. As for somebody who studied public health, I cringe every time I look at examples from like South Korea or even China did a great job. Even though, you know, somebody at the White House would say different, but what is advice you would give the public about COVID-19? What is something that in your line of work and what you want to emphasize to the public that they're not doing right now?
Okay, so I guess what advice would I give to the public about COVID-19 that they haven't heard yet?
Not like they haven't heard, but like there's a lot of like, for example, like to open up
Yes. Okay.
like businesses right now to like there's a lot of fear going out into society and just wondering like I if I go to the grocery store, am I safe? Am I safe if I go to a barber, for example? Like
Yeah.
a lot of people are just wondering and just I think a little bit tired about being in quarantine. But
Yeah.
what's your scientific advice, your public health related advice that you
Yeah.
want to emphasize?
Okay. I think as a public health practitioner, I think this rush to get back to normal is the wrong attitude with dealing with a deadly virus. But as a person that's in, this pandemic, I understand the agitation and the restlessness to get things back to normal, whatever normal is going to be. But I think the best way to get things back to normal is to ensure that the infrastructure is there at the state and city level. So I think state level decision makers need to be making choices based on individual situations that are being experienced at their state risk levels and resource assessments. So I think that these decisions need to be in consultation with community stakeholders. That includes like us as citizens of those communities. And then also businesses and NGOs and other like functions of our communities to make sure that all of them are taking a role, like playing their role in taking actions to protect themselves and those around them. And I think that one thing that has started to happen in some cities is coming up with like solutions for reopening that take into consideration COVID-19. Like, for example, some places are opening up restaurants, but then shutting down streets to increase outdoor seating so that people are socially distanced. So I think the new normal is going to be very different from where we were like 6-7 months ago. We're not going back to that like in a month or two or even in 6 months until we have a vaccine. Things are not going to go back to the way that they were before, which is really sad. But I think if we take this in stride and people are being notified and they're aware of the changes, and state and local authorities are regularly updating the public on what they're doing to keep people safe and the changing circumstances and changes and requirements for businesses. If all of, I think the biggest thing is communication and making sure that people are aware. And then from a personal level, like I think if we have an understanding of what the risks are and how do we mitigate those risks, I think then we have like a greater chance of resolving this issue sooner rather than later, and opening up the economy sooner rather than later. So I think one thing that you can do that's actionable right now is probably, if you're in the US, applying pressure to your local representatives to make sure that those kinds of things are in place so that you can go out to eat with responsibly with the people that you'd like to, and making sure that that you're safe and you're not putting like your area at risk or something like that, So I think, that's what
that's really great. Do you know if a vaccine will be there soon? Do you know if there's going to be, is it like, what have you heard about a vaccine?
I have no insider.
Okay, I was like, maybe this is our insider.
No insider information.
Okay.
But I would say, I think right now the estimate is like 18 to 24 months. And I think it's like probably in the later, not earlier. But I don't know. I think those things are constantly changing, so I have no idea. I have no insight scoop, so I know that
there's this like initiative that the White House is implementing called like Warp Speed, I think, where they're producing, they're like rapidly producing, or like kind of, I believe, kind of cutting the line, or not going through the appropriate steps in order for they're kind of letting a lot of the FDA regulations kind of fall through the cracks, just so that we have a vaccine. So in your opinion, do you think that's a great idea to just kind of like produce any type of vaccine ASAP, or is there going to be some like clinical trials? It's going to go through its normal like lifespan.
I think, you know, this is, I know we've all heard this a million thousand times, but this is like an unprecedented situation for most of us that are living. So I don't know, I can't really speak to, I think as long as it's like responsibly, like doing science responsibly, and it's evidence-based, and it's not just kind of like, you know, earlier when Trump was saying, you know, hydrochloroquine was the drug, you know, like I think if science is the backing for it and it's gone through that process, I think then we can trust it. But I know that there are like some studies that are using, they're kind of taking some shortcuts in the sense of like going through the bureaucratic processes, because a lot of the time you're just sitting on a study waiting for some person to write off on it, and it's not necessarily like the science portion of the entire thing, it's just bureaucratic. So I think if it's kind of like fast tracking things in that way, that's 100% perfectly okay.
That's fine. Okay.
Yeah.
That's one of our like fears, is that like, well, is this vaccine even going to be safe? Is it even going to hurt me? Or should I take it? So
no, I think it'll be safe. It'll follow the process. I just think that the bureaucratic side of things will be, it'll be like on a freeway instead of just kind of sitting down waiting 2 months for approval from some person that's not a scientist, you know?
Right. Yeah, makes sense. And a lighthearted like advice as a public health official is any tips on working remotely, being in quarantine, just kind of being here
in my
house?
I think one thing that works for me is changing, like not wearing pajamas, because if I do, I'm gonna Netflix, like I'm not gonna like work. So I think changing your clothing is a big deal, and then also coming up with a routine and trying your best to stick to that routine. You might falter here and there, but like trying your best to do that, get your like when Ramadan is over you know, getting in like the beverages that you need to keep you energized and focused. Yeah, I would say routine, schedule, change your clothes, wash your face, like take breaks, you know.
Right. I would also also add in like connect with people that you usually don't connect with, or like you like in the hustle and bustle of life, like you usually it's just kind of like, you know, you have it in the back of your mind, oh yeah, I'm gonna call auntie so and so, or I'm gonna call this friend that I haven't like connected. But if we do, now that we don't, I think it's now that we don't have that like that one-on-one like physical, like we can't you know like meet each other, it's really great to have to like just FaceTime someone and just have that, because I know a lot of people are dealing with like depression and like anxiety and things like that they can't like vocalize. So it's really important for them to have some sort of, you know, some sort of support. So
I agree.
Call your family. That's what I'm saying.
Oh my God, yes, of course. I think one cool thing about this is like you can go to events that are typically based places that you don't live, and now it's accessible to you, which is really cool. Like I was doing like some writing workshops that were in LA. I'm not in LA. It was cool.
I know.
There are just some silver linings to this.
I got invited to like this and I'll send it to you, but a World Health Assembly. I never could go. Like I never could. Yeah, so now I'm like everything is completely online. So this might be the new normal. It's like no more conferences.
That's cool. But like it's fun.
I like conferences. I like going home. I hope not. But Mushta, thank you so much. We learned a lot about COVID-19, how to cope, what we should listen to, what we should do. So you're a great asset to this organization. And then we'll try to call and thank you. Happy May 18th. We'll try to call you again once we do this, and like probably it'll be post COVID-19, and then we can talk about like the lesson learned. So inshallah.
Yeah. All right.
Okay,
Nice
Ramadan
chatting with you.
Kareem. Oh my gosh, that was amazing. That I had a lot of like anxiety and I had a lot of kind of questions about COVID-19. Yes, as you can tell by our exchange, we're both public health. We both work and study public health, but having her on infectious diseases and is an asset to me, and I knew it was going to be an asset to all of us. So thank you again, Mushtaq. Like, it was really, really amazing for you to be on this program. So next we're going to have Amina, and I'm gonna see if she's on. She's part of the Somaliland Health Initiative. So she's going to briefly talk to us about the situation in Somaliland. So I know COVID-19 is we've had a few deaths and we've had a couple of...
Can you see me?
Yes, I
Hello.
can. Hi.
How are you, darling? You okay?
Good, good.
Happy Independence Day.
Good. Happy May 18th. Yes.
It's here, finally.
You're live
I
from
hate
work.
this. God.
I see you.
There should be a filter on these things. This is unacceptable.
Come on. There is, but it's
Shut
okay.
up.
You look
That.
beautiful. You look
Dagiga.
beautiful. Don't worry. Don't even try. I don't have one on, so don't even try.
Yeah, the lighting is amazing. MashaAllah. Thanks for that, Walala. So first things first, like we wouldn't be able to do what we do without like the help of the community. So Jazakumullah khair for everybody who supports us. The situation on the ground is a bit weird. So currently, as it stands, I feel like we've got, in the beginning, COVID caught us unaware because we didn't prepare. The problem with Somaliland, it's not just Somaliland, but definitely in the Horn of Africa, is that we love to talk. So having meeting after meeting after meeting after meeting, and none of the meetings were actioned. So it's like there were no, the minutes when nobody was so called putting any of the stuff into action. It wasn't until the cases have arrived that basically the Ministry of Health and the COVID committee just made proper movements, and it wasn't until we've had our first death that's kind of kicked everything into action. Alhamdulillah, but so in the beginning we didn't have the PPE, no PPE, no training. We didn't have COVID centers. And then alhamdulillah, as the situation stands right now, we've got some COVID centers. So Adbase has a dedicated COVID center. And Bura has places that I've mentioned also have the COVID committee as well. So alhamdulillah, that's much better. And then we're getting a steady stream of PPEs into the country. So where we felt that we would make the most impact on is help the Ministry of Health, help them gaining more PPEs as well. Because even we are we're healthcare professionals, so we've got connections in our hospitals as well. So it's like everybody's like tap into the network that you know and see what and also we've got family and friends put money together and buy some stuff for them. So alhamdulillah, we've done that. We've sent our first shipment, and five hospitals are due to receive their MYSLPA, their PPE, inshallah. They just have to pick it up from Hargeisa. That's all they have to do. But also at the same time, what we've been doing as well is just we've been conducting online training as well. So describing the MYSLPA, the disease, and how it presents itself, and what you see, sharing what we've learned here in the NHS, for example, and sharing it with them, and how we can meet in the middle. The thing that in the beginning was everybody was like, oh, we don't have any PPE. But I'm like, listen, so the NHS doesn't have enough PPE. America doesn't have enough PPE. The PPE thing is like, it's a global issue. It's like the whole world was going to the same shop. So I said, please don't be disheartened. We just need to start thinking outside the box. So it was like recommending stuff like a surgical gown. If there's you get a surgical gown, everybody, they do operations over there. Use a surgical gown as a protective gown. I said, get like goggles, just regular goggles that you from science labs. Things like, we've got a lot of TB centers. See if any of the TB centers have FFP3 masks left, and then use that reserve as a respiratory mask. So alhamdulillah, little suggestions like that. And it was we've done like the online training as well. So online training on, like I said, what the disease was and how to put and take off the PPEs as well, because there's a special way to do it. Alhamdulillah, I managed to do that as well. We've had a call from Berbera Hospital this morning. There's an outbreak of dengue in Berbera. So the director's like, it's very, so they said, how do you then differentiate between dengue and COVID? And I was like, they'll just treat everybody as a COVID patient because COVID is, exactly. COVID is contagious, but dengue isn't. So I said you eliminate you eliminate one of the problems that way, but then that just means that we just have to step up our efforts and be like, okay, so and also this thing that we're hearing about the children turning up with toxic syndromes. New York has had an outbreak, hasn't it?
Right, a lot.
We've had a couple of cases as well. We've had a few cases where we've had these children with this toxic syndrome, and it's COVID-like, related to COVID, but may not be COVID. So again, we're still learning. So again, it was also sending PSA out to Somaliland and say, guys, you may want to look out, and Arurta as well. They're coming up with this, and that might be related to the disease and whatever else is happening right now. So I feel from a no, you're right. Dengue doesn't have any respiratory symptoms, but it's the fever, it's the humadda, is the aches and everything else that comes. It's a bit COVID-like. Hadda. The main thing is, I feel like what we've all kind of neglected is public service, public health awareness. So obviously, Halito, 17th of May, Hargeisa was lit. Everybody was out on the street. There was a parade today. So it's like, guys, which part of Guriga Joga and no parade do you not understand? So then we're just going to, I think we're going to be, in the next few coming up weeks, inshallah, we're just asking everybody to speak to their relatives, to speak to your family and friends, make sure everybody stays at home. Or just reduces any unnecessary travel in La Calafogado, and basically because I think what the thing that a lot of people don't understand, not just in Somaliland but here in the UK and the US, is like you can be asymptomatic. You can have the virus, but you can be asymptomatic and not show any symptoms, but you can infect. So basically, why are you guys telling me this? And also there's this really bad trend in Somaliland where they go for iftar together, and then they think just because they sat outside having iftar, they're not infecting themselves. They're like, oh, for the love of God. It's like, no, guys, please,
And there's a huge
it's been hard work.
There's a huge stigma back home as well, as that they don't want to say that, like, they'll have like symptoms, and they'll just say, no, it's just a cold. Exactly. Like, they don't want to get tested because they're scared that they're going to be stigmatized and like put in a corner. So this is like, we do need public health awareness, and to make sure that we that can now, because there's a lot of like false information that's going around. So it's very hard to kind of like gauge those WhatsApp groups and gauge these random false claims about COVID-19. So it's really important, and I thank you so much for all of the initiatives that you're spearheading and that you're.
No, it's okay. We'll try I've got an amazing team. Honestly, there's a big team. It's like I'm just literally like the person who talks about it. But there is a big, massive team that's doing like a lot of the work. And all we're doing is because we've had the privilege of going to Somaliland and connecting with the hospitals, especially all public hospitals. We're the connection, we're the middle people basically. So we can look on and we know what the hospitals are like, and we know what the first trip in 2018 that we did was we did a scope of services, what's available versus what's not available. So when it comes to buying equipment or procuring stuff, we can say this hospital has this, that hospital hasn't got it. But inshallah, the first thing I really want to, we've sent a big list, a comprehensive list of like what to do, why self-isolation, why do you need to self-isolate, and what happens after the self-isolation period, and we've tailored it to Somaliland. So inshallah, there's a whole group of other healthcare professionals based in Somaliland who are going to lead it. So the message, it has to be, I feel like the message has to come from the local doctors and the nurses themselves, healthcare professionals over there, and they can push it. All we can do is guide them and say, this is what you guys need to, this is what you need to do, this is how we want you to deliver it, and we need to talk to the people on a level as well, because it's like this, we're very, very sharing. I mean, I'm hearing things like we're sharing face masks, and it's like, no, please, I know. Essentially, look, you get rid of one problem, right? You get rid of the way the whole Somaliland thing is like you get rid of one problem, and then and you're like, but why? So
no,
it's like a never-ending time.
Yeah, so there has to be we have to link with the government and make sure that there's like one voice, like one thing that they're putting out, because like if we've learned anything from the United States, we get multiple messages from the government and we just like right? So it's really important that once we advocate for, like, you know, everybody wear a mask, everybody wears mask. If everyone needs to social distance. The one thing that I will commend the government on is they stopped Qad from Ramadan. I hope it was for COVID-19 reasons as well, because that's a great, because people congregate and, like, you know, there's mafrishes and things like that, so that's not a very good idea to do that. And as well as I believe they shut the mosques down for Taraweeh. So
the mosques, but the best thing that they've done is the border. They've secured the borders, because when the whole thing kicked off in Djibouti, there's a lot of people coming from Djibouti and into Somaliland by foot. So, you know, like, you can easily, people forget that you can easily walk in between the countries, from Ethiopia as well, from Somalia as well. So that's wrong. So it was basically the main thing of what they was like, protect the borders first things first. That's what you can control, and then we'll deal with the problem once it gets inside. But alhamdulillah, and also they're doing with it the past 2 weeks as well. They've been sending stuff over to the Gabalaha, and they've also mobilized many little COVID committee members to go and help out the other hospitals as well. So alhamdulillah, it's a joint effort. But I feel like what we forgot in the middle of everything is the public, and hence why the public is doing what they're doing. But like a friend of mine showed me yesterday a video of I don't know, have you seen I don't know if it's a comedy skit of It's Three Lights, but it's basically the guy who's spraying people before they get to the bus.
Oh my, I didn't see that. What?
So I mean, it's funny. It looks like real life, but apparently it's a comedy show. But to me, it's a bit too real. But Amina is like, he said, Amina, you know, the minute that our people start making jokes out of it, that's when you know that it's real, that people are taking it serious. And I'm like, well, alhamdulillah, you know, finally. So I feel like we can do it. We can do it. COVID will not beat us, and COVID will not like destroy us. I think we'll get there. The thing about Somaliland is that it eventually gets there. People forget this. We eventually get there. But what's it called? We go through this little curvy path.
Denial.
And I do have faith.
I have the same thing too. When I first came to the United States, I was denying it. I was like, oh, this is nothing. It's just a flu, this and that. And so you had to like be like, okay, this is a very, very serious issue, and we need to kind of hunker down and lock ourselves and make sure that we save our really vulnerable population, mostly the the older population and people with conditions. So thank you again for joining us today. It's really, really important.
It's fine. Thank you for having us. Thank you for having us. For everybody who's in the comments, basically, guys, we're going to be showing all of the work that we've done for Somaliland on our thingy tonight on our Instagram. So come join us, and please follow. Yeah, make sure you follow us. And number 2, make sure you tell your families in Guriha Pakistan, because we forget how powerful the diaspora is. Just take a phone call. I'm sure you're sending money to your families, as you know, for Eid Mubarak. Please, as you're sending the money, just tell them that to stay at home as well, because we've got a very powerful voice. So istimala it's okay.
Thank you so much.
No worries. Thank you. And happy Independence Day, everybody. Bye. Take care, sweetie. Bye. Assalamu alaikum.
Thank you so much to Ambassador Bashir Gold. Thank you so much, Mushtaq. Thank you so much, Amina. It's been a great discussion.